Let's talk about empathy for a second. I personally find it very hard to believe that somebody who spent 10 to 12 years of training, paid with their health, with their relationship, with sleepless nights, and very, very much effect on their health, came to this profession to be mean or unempathetic. I did my master thesis on empathy within medical students, and I found quite worrisome results. Most of the students were already lacking empathy when entering medical school. It has a lot of factors to it, but many medical schools, more than often, are not screening for empathic tendencies, but rather dry grades. But even if they were, by the last 2 years of medical school, there is a dramatic deterioration in empathy. I believe that the reason is actually the work setting and constant bullying by other peers just because they were bullied as young doctors, young nurses, and so forth and so on. Patients are so afraid of talking to doctors sometimes because of those bad experiences. And for me, empathy and compassion and the dialogue and partnership between doctors and patients is the cornerstone of optimal healthcare. Empathy can be restored. My thesis and many other academic work has shown that intervention like what I did, a 4 hours training seminar for empathy, can actually dramatically improve the empathic tendencies. But I cannot change by doing this seminar the entire work setting of doctors. And as mentioned before, making sure that the people treating patients are being treated fairly themselves and are happy in their work and are healthy is the way to move forward. And for patients, understanding the other side is the key. Restoring empathy can be simple as showing patient stories. A lot of times doctors are so worn off by seeing repeated patients. I was a clinician myself. It's very hard to see people in their darkest hour, pain and misery, constantly. There are a lot of doctors who are being depressed and traumatized by this, and also patients being depressed and traumatized by constant medical abuse. Empathy for me in healthcare is the belief that the other side is a human being that can be your father, mother, sister, brother, friend, and partner. And it sounds easy to say, but I noticed it from hundreds of keynotes that I did that not a single eye was left dry when I share my story from both sides of the patient bed and how my life were dramatically affected by lack of empathy. And I think medical students and medical doctors are not encountering enough stories as such. They see a lot of actors portraying patients. Some rare cases, like Nidhi will talk about, there are actual patients that are helping train doctors, but more than often, doctors are being shablonized into treating patients as a sack of symptoms and not human beings. The reason is to protect their mental health from being too attached, too sad, too affected. I believe there is another way. Empathy, compassion, and better communication training for all that can be done using those inputs from patients and doctor, human, experience-centered representative, and by using patient schools to train those traits.